Jonty Garlic, I'm a physio. My wife and I run a Pilates studio in Taupo, which is where we're standing right now. It's paradise on earth.
My name's Kath and I'm a physiotherapist. I have been a physiotherapist since 1995, which means I've been doing this for 23 years. I currently work in a private practice in Auckland. I keep it down and then just push the ball up.
Pam Allen, and I'm a pink physiotherapist, and I work in Timaru at My Physio, which is a clinic we set up in 2008.
Both Tam and I are pink and steel trained, so we work with rehabilitating or helping cancer survivors get back into life again.
I've been working in cancer rehabilitation for 5 years now.
And I really enjoy the fact that when you see a patient first coming in and how they kind of are sort of with post that immediate diagnosis and their initial surgery, how they actually change over those first few weeks and how they actually build a relationship with you and really become to trust you.
It's a really rewarding experience. You get to work with these people who are starting from ground zero really, and they are, a lot of them are struggling to live, and then you start to work with them and they start to come alive. It's fantastic. It's one of the most rewarding aspects of my job.
As a physiotherapist, I think people affected by cancer need rehabilitation to get the most out of themselves following surgery and cancer treatments, including radiation and chemo. And people need to be rehabilitated, because if not, they'll accept their current level of function as the new norm without necessarily knowing that they could achieve so much more.
So probably the most rewarding part would see people who think that they're potentially going to be left with a long-term functional issue, that then all of a sudden that you can actually show them that they can improve still, and they may not get to absolutely 100% or what they were beforehand, but you can actually make a massive difference to their quality of life.
And you can get sports people who all they want to do is get back out on the sports field, whereas the cancer people, all they want to do is get back to a normal life. Yeah, I love it, it's great.
There's a huge amount of people that are affected by cancer, either currently or they're in remission or they're living with cancer, and being able to help them is a great tool to add to our physio toolbox.
I love my job. I love my job. I love the fact that I feel like I make a difference in people's lives. When they're going through a really tough time, I would almost say that's one of the toughest times that people can go through their lives, is getting a cancer diagnosis. So I think being able to help someone through that, and I think I have a really, seeing so many people and so many patients, I think I get a real understanding. So having that understanding with the patients really makes a difference.
The highlight for me is making a difference in people's lives, and whether that's just a small difference with helping them to regain their movement in the shoulder after surgery, or whether it's empowering them to change their lifestyle and to take steps and measures that might ultimately improve their longevity or improve their quality of life.
It's definitely a highlight to my career doing pink, and definitely put a passion into my work.
That's what it's about. It's about learning to get back on and get on with life. Yeah, it's great.
I love it. I love seeing the changes. I think you see changes in your normal musculoskeletal work, but not the same in terms of that whole, I think the emotional side of it is probably one of the biggest things that I see, yeah.